Are there any new techniques, like maybe using like modified Ravage that would help those older patients that you are not operating on, and what it looks like for them?
So the reason I don't operate on older patients isn't because I can't do it. It's because the recovery is so much harder. Um, the Ravage is not a new technique. The modified Ravage is not a new technique. It's been around since 1949, and it is basically cutting out cartilage and letting your chest try to heal back. The older you get, the worse your healing abilities are. And so if you do a ravage on an older patient, there's a good chance that those pieces aren't going to heal back together. I have probably done more ravages than most people do in their lifetime. I think I still have the largest series of ravages in adults out there. And that's how I was trained. This is what we did. I will never do a ravage on a patient that I don't absolutely have to now because it destroys the flexibility of their chest. It creates this rock hard, surface. Sometimes with carinatum, you have to cut, but I'm not cutting out a bunch of abnormal cartilage. I'm not letting the chest wall try to regenerate and grow back. And so there are no new techniques with Ravage. The newest thing that's out there is what they call Pectus up, which is basically like an outside brace, and you crank it like a screw top, try to get the chest out. That works on young, flexible patients that have nice little round defects. It doesn't work on a big, long chest. It's not great in adults, and nobody's pushing its use in adults because it doesn't work well. Um, you know, 3 bars sometimes is barely enough to push somebody's chest out. And if it won't come out, if it breaks, then you got to fix those things. You maybe have to make an osteotomy cut, but I always do a combined procedure where I'm still using those NUS bars to push the chest out. And then I'm just fixing that individual rib or that individual spot that's a problem. I'm not cutting both sides, all the cartilage out and letting that chest wall try to regenerate and grow back. Because I will tell you, it does not. It may turn into a hard rock, but it is not regenerating normal cartilage and to a normal flexible chest wall. You always have some restriction with the ravages.
I appreciate you mentioning Pectus up too, because that's people like to seem to think that's like a shiny new
Mhm.
surgery and they
New,
don't
shiny new
understand.
toy.
Yeah.
Well, the one that I thought had some possibility was the magnet. And so they were going and they were putting a magnet behind the chest, and then they wore like a brace so that the magnet was constantly pulling out. Those younger patients, it worked on the young guys. It seemed to work very well. But in that trial, they were only wearing the brace for 18 months, and then the patients were recurring after that. And so I think that, if you're going to do something like that, you're going to have to keep it on them for years and years and years as they're growing. And the problem is kids don't want to wear a brace. Nobody wants a brace, right? And, if you do carinatum bracing, you're looking at 6 months to a year. And, that's enough suffering for them to do. But if you're talking about a kid wearing a brace for, 3, 4, 5 years during all their high school and, and their growth years, it's just not ideal. And so again, it's less invasive, it's more gradual. And there's probably some other things along that line coming out in the future, but none that I know specific that I think is the panacea for all the ills.
Is it fair to say that any of these procedures that try to lift the sternum, whether it's through the magnets, vacuum bell, or through the bars, there's still the concept that the chest needs to be in that shape for multiple years. So that's probably why the vacuum bell, you have to wear it for so long because you're
Yeah,
trying to reproduce what the NUS does 24/7. Is that a fair?
correct.
Okay.
Yeah, I mean it's all about time, right? If you put the vacuum bell on like a kid, it pops a defect out completely. You're like, oh wow, that's pretty cool. But as soon as you take it off, it collapses back in. And so it becomes a matter of time. And some of the European studies on the vacuum bell, those guys slept all night long with them. They wore the vacuum bell, for like 12 hours straight. they did very well. Those groups were very successful. They wore them for years while they were sleeping at night and stuff. They didn't wear it during the day, but they got 70, 80% correction on those patients, which is, excellent.